Hi, everyone. Welcome back to another Wellness Wednesday. I'm Sydney,
I'm Krista.
and today we're going to be talking about OCD and OCPD. So, to start off, OCD, which is obsessive compulsive disorder, is a common, chronic, and long lasting disorder in which a person has uncontrollable, reoccurring thoughts and/or behaviors that one feels the urge to repeat over and over. As for symptoms of OCD, they can be divided into obsessions and compulsions. And so, some examples of obsessions can be fear of germs or contamination, unwanted, forbidden, or taboo thoughts involving sex, religion, or harm, aggressive thoughts towards others or the self, and also having things symmetrical or in a perfect order. As for examples of compulsions, those can look like excessive cleaning and/or hand washing, ordering and arranging things in a particular or precise way, repeatedly checking on things such as repeatedly checking to see if the door is locked or the oven is off, as well as compulsive counting. And I know a lot of these obsessions and fear and compulsions examples can seem like things that you might relate to, or might just seem like, oh, I do that. Like, do I have OCD? But what sets these obsessions and compulsions apart from just maybe like occasionally having that thought is that these obsessions and compulsions, like someone who has OCD, they can't control these obsessions and compulsions, even though they know that these behaviors or these thoughts are excessive, they still can't control them. And someone with OCD may also spend at least an hour a day with these thoughts and behaviors, and they don't get any pleasure from performing the behaviors or rituals, but might just feel a brief relief from the anxiety that the thoughts cause. And lastly, what makes these obsessions and compulsions OCD is that one who has OCD will also experience significant problems in their daily life due to these thoughts or behaviors.
Yes, I'm going to talk about OCPD. OCPD stands for Obsessive Compulsive Personality Disorder. OCPD is a type of personality disorder with a couple of traits that I will talk about now. First of all, people with OCPD are often obsessively focused on perfection and order. For example, they might like to keep their desk as organized as possible with certain layouts and placement. Another trace of OCPD could be difficulty to understand others' point of view or to accept comments from others. In addition, people with OCPD could also reflect a sense of righteousness about the ways things should be done and could also have high standards in life. So, what are the symptoms of OCPD? I have researched and found some symptoms of OCPD. Keep in mind that while the symptoms of OCD could be inconsistent, the symptoms of OCPD are usually more consistent because it is considered a personality disorder. To begin with, an overwhelming amount of devotion to work that negatively impacts social and family activities could be a symptom of OCPD. Excessive focus on lists, rules, and minor detail would be also a symptom. As mentioned before, perfectionism interferes with finishing tasks could be seen as a symptom of OCPD. In addition, the unwillingness to assign tasks unless others perform exactly as us could be a symptom. Last but not least, people with OCPD could show a lack of generosity as part of the symptom of this personality disorder. What causes OCPD? Various answers could be found online. However, there is no single specific cause identified for OCPD. Several theories suggest that people with OCPD may have been raised by parents who were away or absent and either overly controlling or overly protective. Also, as children, they might have been harshly punished. The OCPD traits may have developed as a sort of coping method to avoid punishment, to try to be perfect and obedient.
Yeah, so thanks for sharing about what OCPD is, Krista. So now that we've gone over both what OCD and OCPD are, I'm going to go over the difference between the two. So people with OCD have insight, meaning that they are aware that their unwanted thoughts are unreasonable. People with OCPD, on the other hand, think their way is the right and best way and usually feel comfortable with such self-imposed systems of rules. Additionally, the thoughts, behaviors, and feared consequences common to OCD are typically not relevant to real-life concerns, whereas people with OCPD are fixated with following procedures to manage daily tasks. Also, often OCD interferes in several areas in a person's life, including work, social, and/or family life, whereas OCPD usually interferes with interpersonal relationships but makes work functioning more efficient. It is not the job itself that is hurt by OCPD traits, but the relationship with coworkers or even employers can be strained. Typically, people with OCD don't believe they require, typically people with OCPD don't believe that they require treatment. They believe that if everyone else conformed to their strict rules, that things would be fine. The threat of losing a job or a relationship due to interpersonal conflict may be the motivator for therapy. This is in contrast to people with OCD who feel tortured by their unwanted thoughts and rituals and are more aware of the unreasonable demands that these symptoms place on others, often feeling guilty because of this. And lastly, family members of people with OCPD often feel extremely criticized and controlled by people with OCPD. Similarly to living with someone with OCD, being ruled under OCPD demands can be very frustrating and upsetting, often leading to conflict.
Yeah, so how common are obsessions and compulsions? Obsessions and compulsions are quite common in general population. In a recent survey, they were reported in over 28% of people. Do people with OCD really believe those irrational thoughts? Most people with OCD are well aware that their obsessions and compulsions are irrational. For example, people with OCD could have fears of losing their house by leaving the air on, or they could feel like their hands are full of deadly germs. In order to stop those negative thoughts and mental assumptions, they have to perform those compulsive behaviors such as repeatedly washing their hands or driving all the way back home to check the error.
Yeah, that's great. That's awesome. Well, not necessarily. I think for someone who has OCD, that often really does not feel good. But I think a common thing that is associated with OCD specifically is being a neat freak and a germaphobe as being symptoms of OCD. However, being a neat freak or a germaphobe, that is not necessarily OCD. It might be OCD though, if someone knows that their greater than average concern about neatness or germs is excessive, if they wish, and if they wish that that concern would stop and if it causes them distress. However, if the individual just likes neat things and is comfortable with that, then that is best understood as a part of their personality, and not as OCD, which means that it would mean that they most likely would have OCPD. I think an interesting example of this that can be seen in media is the character Monica from Friends. She's often portrayed as someone liking things a very particular way, having things cleaned in like her way. And I think a lot of times people see that and think, oh, she has OCD. But through seeing like how she is with just liking things a certain way, it doesn't necessarily cause her distress if like her thoughts of needing things to be clean. It's not something that is like torturing her life in any way. It's just something that she likes a certain way, which means that it is more likely OCPD than OCD. As well as now on to if OCD or OCPD, are they treatable? So for both OCD and OCPD, psychotherapy and medication, when properly used, can substantially improve OCD symptoms in a majority of patients, as in like up to like 60 to 70% of patients.
Yeah, thank you for sharing. I have some questions for you, Sydney. What do you first think of when the term OCD or OCD is mentioned?
Well, when I first hear OCD, I definitely think of what we mentioned at the beginning of this video in the fact that OCD is something that can really affect someone's life, causes a lot of distress. Whereas when I hear OCPD, it's something that I recently learned about, but I definitely think of like a lot of these other portrayals of characters in TV shows and movies that I've seen as characters that I used to think were OCD, or had OCD, but in reality, they actually had OCPD. What about you, Christa?
When I first think of those terms, I think about those actions like repeatedly cleaning or washing hands, something like that. I think this is a stereotype because that cannot be called like OCD or OCPD.
Yeah, that's awesome. So, what would you do if your friend had been diagnosed with OCD or OCPD?
Well, that's a great question. I will first make sure that I'm being a good active listener when my friend is having conversation with me. I would avoid showing negative emotions or criticism when I'm with my friend. More importantly, if my friend is not already in a treatment or counseling session, I will use careful communication to encourage my friend to obtain professional assistance and treatment. Last but not least, I would not put the burden and stress simply on myself, and I would like to encourage other friends to help create a sense of community for my friends with OCD symptoms. How about you?
Yeah, I think very similar to you. I would just, especially if a friend was diagnosed more so with OCD, I think I would just be very patient with them. And this can also go with just talking to anyone who's diagnosed with OCD. And I think not just being diagnosed with OCD, but if you hear someone talking in a way that sounds like they might have like OCD or OCPD, actually, I would just keep in mind that a lot of times, especially if it is OCD, they know that their thoughts or their behaviors are excessive or just irrational, but but what comes with it is that they can't stop it. It's just something that they need to do that they can't stop thinking of. And so I think if a friend was diagnosed with OCD, or if you know someone, talking to them and just validating what they think, but also trying to help them to like calm their anxiety that comes with the thoughts or the compulsions.
Yeah, I agree with that. So, what are some tips that we can be mindful of when talking to OCD patients?
Yeah. So, yeah, similar to what I was just saying about talking with friends, if you're talking to some like a patient who has OCD, just really being mindful of the fact that they know or they are most likely aware of how irrational their thoughts are, and just really being patient with them and working with them to just ease their anxieties and to yeah just being patient with them. I think that's like the biggest thing that you could do. What about you?
I'm thinking about same thing, and I don't. If I'm talking to a OCD patient, I don't want to let them feel very stressful and talk to them that you have OCD or you have OCPD, something like this. We need to be more patient of talking about this and more aware of to talking about OCD.
Yeah. So I think the last thing that we're going to just kind of talk about is just our own personal experiences and perspectives on OCD and OCPD. So yeah, how about you, Krista?
Yeah, from my personal perspective, I think I had experiences similar to both OCD and OCPD. I have personally had thoughts and questions on whether I have OCD or OCPD or not. For example, I think I had an ambition on with keeping the sink clean because I would feel uncomfortable when I see a sink with dirty dishes. Also, I would often check multiple times on garage door after I leave the house because I would always fear of leaving the garage door open. What I would like to say after these examples and experiences is I think we should not jump to the conclusion on our mental health. While it is ideal to take precautions, sometimes these moments of potential OCD symptoms are simply our pet peeves. However, please do not hesitate to reach out for help when these pet peeves are negatively affecting your daily lives. How about you, Sydney?
Yeah, so I think personally, when I was younger, I used to think that OCD was the typical like, oh, liking things in a certain order and just kind of being nitpicky about things. But as I started to get older, I learned like what it actually was. And so after that, I never really would think that I had OCD, but I did occasionally have those certain thoughts of like, oh, like, did I lock the door? Did I do this? Did I do that? But I think what kept me from ever going further and thinking like, oh my gosh, do I have OCD is the fact that I would be able to kind of just dismiss the thought after I think about it. I'm like, oh, did I lock the door? And then I'm just like, well, you know what? I don't know. And so yeah, and if anything, I maybe if I knew about it back then, I would have thought, oh, maybe it's OCPD, but I don't know. But something else that I really think is important in just my experience, and I think a lot of other people's experience with OCD and OCPD is the idea of the language surrounding it. A lot of times you hear people say, oh my gosh, I'm so OCD, when they just, maybe they want their desk to like look a certain way and they like things in a certain spot or anything like certain orders or like washing their hands a lot, just, things like that. I think it can be really hurtful to someone who actually does have OCD and knows what it's like to struggle and how frustrating it can be to have these thoughts and behaviors and know that they're just irrational, but not being able to stop them. So I think it's really important that we're all just very careful about our language and just knowing that saying something like that, like, oh, I'm so OCD, it's hurtful. For example, like if for like any other mental illness, if someone, was depressed and someone who's just like mildly sad for like the day says, oh, I'm so depressed. That's not what it feels like to necessarily be depressed. And that can really affect someone with depression. So in the same way with OCD, just liking things in a certain way does not necessarily mean you have OCD. And I just really wanted to just put a lot of emphasis on really just, taking note of the way we say certain things, especially surrounding mental health. But yeah, so thank you everyone for listening. Yeah, that's all we have for today, and we'll see ya.
Thank you for listening. Bye.
Bye.